Hey friends, welcome back to Breathe Easy. This is episode 29 and I'm so glad you're here. Today we're opening up a topic you've probably seen scribbled on a whiteboard or heard in rounds, but maybe have never had it explained start to finish. ICU Liberation and the A through F bundle. And I know the moment anyone hears the word bundle, the eyes glaze over. Great. One more thing to chart. So here's my promise for the next few minutes. We're not adding work, we're organizing the work we already do. ICU Liberation is a coordinated, evidence-based way of caring for critically ill patients so they do not just survive the ICU, they actually recover from it. Think of today as the trailer. The deep dive comes from the episodes ahead. And our teaching point that we hope to land is the A through F bundle is the framework the Society of Critical Care Medicine built to put the PADIS guidelines into practice for every ICU patient every day. Let us set the tone because how we talk about this really matters. This episode is intentionally conversational. No death by slide, no drowning anyone in alphabet soup, no reading the guideline out loud to people who already are slammed at the bedside. Instead, one patient story, one big idea, and a few analogies that stick, and a clean runaway into the next 6 episodes. Here's the core teaching point I want you to hold on to. ICU Liberation is simply about helping patients leave the ICU better than they otherwise would. Society of Critical Care Medicine frames the bundle as a way to improve outcomes and honestly transform intensive care unit culture. So as you listen, notice that it's less about a checklist and more about how a whole team works together. Let us ground this in someone we all recognize. Picture a patient on a ventilator, sedated, unable to talk, not moving, with family at the bedside trying to make sense of it all. Every discipline is busy doing their individual task, but step back and ask the bigger question, how do we move this person from simply surviving to actually recovering? That question is the whole reason ICU Liberation exists. The bundle targets the things that quickly stack up against recovery: pain, agitation, and sedation, and delirium, and immobility, and disrupted sleep. And it treats them as connected, not as separate boxes to check. If you forget everything else, this is the sticky note. ICU Liberation is about reducing the harm that comes with critical illness and ICU care, while actively promoting recovery. Say it plainly, the ICU saves lives, and at the very same time, critical illness and the interventions we can use leave patients with lasting complications. Oversedation, delirium, weakness from lying still, prolonged time on the ventilator. The bundle is how we lower that risk together. In practice, that looks like less oversedation, less delirium, earlier mobility, earlier ventilator liberation, and more family engagement, and a sharper focus on recovery. Let me give you an analogy that sticks. The A through F bundle is like an orchestra. Pain, breathing, sedation, delirium, mobility, and family engagement each play their own part. And if one section is off, the whole piece sounds different. Think about how they connect. Too much sedation can suppress breathing and stall mobility. Immobility deepens weakness and slows recovery. Delirium undermines communication, safety, and a patient's ability to participate. The goal is not for any one player to play louder or take over. That is why the bundle was built as a 6 linked elements. A is pain, B is spontaneous awakening and breathing trials, C is analgesia and sedation, D is delirium, E is early mobility, and F is family engagement. So now that you can hear the whole orchestra, let's meet the musicians one section at a time. So here's our orchestra, 6 musicians, 1 for each letter of the A through F bundle. A is the pain detective, whose part is to assess, prevent, and manage pain. B is our wake-up crew, running spontaneous awakening trials and spontaneous breathing trials. C is the sedation strategist, dialing in the right medication at the right depth. And D is the delirium hunter, working to assess, prevent, and manage delirium. E is the mobility coach, getting patients moving early when it's safe. And F is the family partner, there to engage and empower families. Each of these players get their own solo in the episodes coming up, so keep them in mind as we go. So let's talk about respiratory therapy, because this is easy to get wrong. A lot of people just assume respiratory therapy just owns the B element. Not quite. B touches the entire bundle. Ventilator liberation is tied to sedation. Sedation drives wakefulness and delirium risk. Delirium affects whether a patient can safely mobilize, and mobility feeds the direction into recovery. Respiratory therapy sits right in the middle of those conversations, constantly reading oxygenation, ventilation, worker breathing, readiness, and safety, and bringing the real-time assessment into the team's decisions. So here's the point. Respiratory therapist is not just a single letter. The RT is the connector. We will give SATs and SBTs their full deep dive in episode 31, but today we're just setting the stage. So let's bust a few myths. Myth 1, this is just another nursing project. The reality is that it takes a whole team. Nursing, respiratory therapy, providers, pharmacy, families. Myth 2, it only applies to vented patients. Well, the reality is the core principles support ICU recovery broadly, and that is well beyond just a ventilator. We have other patients in the ICU as well. And myth 3, it is just more work. Actually done well, the bundle coordinates the work we're already doing and gives everyone a shared language and shared terminology. If one of those myths sounds familiar to you, you're not alone, and that's exactly the assumption we want everyone to rethink. So why does this matter? Ask yourself one question. What would you want for your own family member? You would want them to be comfortable, awake when it is possible, breathing on their own when they're ready, moving when it's safe, experiencing less delirium, and surrounded and supported by their family, and genuinely pointed towards recovery. That is why, and it's not a soft why. It is backed by evidence across studies of more than 20,000 patients. The bundle has been shown to reduce delirium and coma days and lower ICU readmissions and decrease the likelihood of dying in the hospital within 7 days. The letters matter because of the patient that is behind them. Let us wrap up and look ahead. Today is the trailer, The Wide View. Episodes 30 through 35 are deep dives, one per letter. A is pain, B is SATs and SBTs, C is sedation, D is delirium, E is mobility, and F is family. Next up is A, assess, prevent, and manage pain. So here's the thought to leave you with. The A through F bundle is not 6 separate interventions, it is 6 ways we help patients move from surviving critical illness to recovery from it. Thanks for spending this episode with us. Breathe easy, and we'll see you next time.